Welcome to our deep dive into one of the most chilling aspects of human history, the deadliest viruses that have shaped our world. From the Black Death to the more recent Ebola outbreak, these microscopic entities have not only claimed millions of lives, but have also altered the course of societies and economies. In this video, we'll explore some of the most lethal viruses known to humanity, examining their origins, transmission methods, and the devastating impacts they've had on populations throughout history. Understanding these viruses is crucial, as it helps us appreciate the resilience of humanity in the face of adversity. Each outbreak has taught us valuable lessons about public health, the importance of scientific research, and the need for global cooperation in combating infectious diseases. As we navigate through the stories of these deadly pathogens, we'll uncover how they've influenced medical advancements and shaped our responses to health crises today. Join us as we unravel the mysteries behind these formidable foes, highlighting not just the horror they've inflicted, but also the hope and progress that have emerged in their wake. By understanding the past, we can better prepare for the future. Let's get started. The Black Death, which swept through Europe in the 14th century, remains one of the deadliest pandemics in human history. Originating in Central Asia, the plague spread rapidly along trade routes, reaching Europe by 1347. Carried by fleas on rats, the disease infiltrated cities and towns, decimating populations at an alarming rate. Within just a few years, it is estimated that the Black Death claimed the lives of 25 to 30 million people, roughly one-third of Europe's population at the time. The societal impacts were profound. Communities were shattered, economies collapsed, and a pervasive sense of fear gripped the populace. With so many lives lost, labor shortages led to increased wages for workers, ultimately shifting the balance of power between the classes. This upheaval also spurred changes in religious beliefs, as many sought explanations for the catastrophe, leading to a rise in superstition and scapegoating. In the long term, the Black Death prompted significant changes in public health policies. Authorities began to implement quarantine measures and improve sanitation practices, laying the groundwork for modern public health systems. The lessons learned from this devastating pandemic continue to resonate today, reminding us of the importance of preparedness in the face of infectious diseases. The Spanish flu of 1918 stands as one of the most devastating pandemics in history, infecting about one-third of the global population and resulting in an estimated 50 million deaths worldwide. The virus spread rapidly, facilitated by troop movements during World War I and the crowded conditions of military camps. Its high mortality rate was particularly alarming, with young, healthy adults being disproportionately affected, a stark contrast to typical influenza patterns. The impact on healthcare systems was profound. Hospitals were overwhelmed and medical staff were stretched thin, often falling ill themselves. The sheer volume of patients led to a shortage of supplies and a desperate need for innovative care solutions. Societal behavior also shifted dramatically. Public gatherings were curtailed, masks became a common sight, and many communities implemented strict quarantine measures to curb the spread. The Spanish flu taught us invaluable lessons about pandemic preparedness. It highlighted the importance of timely communication, the need for robust healthcare infrastructure, and the necessity of global cooperation in disease surveillance. These lessons remain relevant today as we navigate the complexities of modern pandemics, reminding us that vigilance and preparedness are key to safeguarding public health in the face of future threats. The HIV/AIDS pandemic has profoundly impacted global health since it emerged in the late 20th century. As of 2023, approximately 38 million people worldwide are living with HIV, with around 1.5 million new infections reported each year. Global response efforts have evolved significantly, with initiatives aimed at increasing awareness, improving access to testing, and providing antiretroviral therapy. Organizations like UNAIDS and the World Health Organization have played crucial roles in mobilizing resources and coordinating international efforts to combat the epidemic. Despite advancements, stigma surrounding HIV/AIDS remains a significant barrier to effective treatment and prevention. Many individuals face discrimination and social isolation, which can deter them from seeking testing or treatment. This stigma not only affects those living with the virus but also perpetuates misinformation and fear within communities, hindering public health initiatives. On a positive note, There have been remarkable advancements in treatment and prevention strategies. Antiretroviral therapy has transformed HIV from a fatal disease into a manageable chronic condition, allowing individuals to lead healthy lives. Additionally, preventive measures such as pre-exposure prophylaxis or PrEP have proven effective in reducing transmission rates. As we continue to address the ongoing effects of the HIV/AIDS pandemic, it is essential to promote education, reduce stigma, and ensure equitable access to healthcare for all. The Ebola virus, first identified in 1976, has caused severe outbreaks primarily in Africa, with the most notable occurring in West Africa between 2014 and 2016. Symptoms of Ebola include fever, severe headache, muscle pain, vomiting, diarrhea, and in some cases, internal and external bleeding. The virus is transmitted through direct contact with bodily fluids of infected individuals, making it highly contagious in healthcare settings and among caregivers. The impact on affected communities has been devastating. The loss of life, with thousands of deaths reported during major outbreaks, has left families shattered and communities in mourning. Healthcare systems, often already strained, faced overwhelming challenges as they struggled to manage the influx of patients. Many healthcare workers became infected, further exacerbating the crisis and leading to a significant loss of trust in medical institutions. International response efforts have been crucial in controlling outbreaks. Organizations like the World Health Organization and Médecins Sans Frontières mobilized resources, provided medical care, and implemented containment strategies. However, ongoing challenges remain, including the need for improved healthcare infrastructure, better surveillance systems, and community education to combat misinformation. As we continue to learn from these outbreaks, strengthening global health systems and fostering collaboration will be essential in preventing future Ebola outbreaks. The COVID-19 pandemic, caused by the novel coronavirus SARS-CoV-2, emerged in late 2019 and rapidly spread across the globe, leading to unprecedented challenges for public health systems. Within months, countries implemented lockdowns, travel restrictions, and social distancing measures in an effort to contain the virus. The global response involved collaboration among governments, health organizations, and researchers, resulting in the development of vaccines at an unprecedented pace. The pandemic has had profound economic, social, and health impacts worldwide. Economies faced significant downturns, with millions losing jobs and businesses shuttering. Social interactions were drastically altered, leading to increased feelings of isolation and mental health issues. Healthcare systems were overwhelmed, with hospitals struggling to manage the surge of COVID-19 patients while continuing to provide care for other medical needs. Vaccination emerged as a critical tool in combating the pandemic. The rapid development and distribution of vaccines have proven effective in reducing severe illness and hospitalizations. Public health measures, such as mask wearing and hand hygiene, remain essential in controlling the spread of the virus. As we navigate the ongoing challenges of COVID-19, the importance of vaccination and adherence to public health guidelines cannot be overstated, as they are vital in protecting communities and paving the way toward recovery. In this video, we explore the historical significance and impact of some of the deadliest viruses that have shaped human history. From the catastrophic toll of the Black Death to the ongoing challenges posed by the HIV/AIDS pandemic, each virus has left an indelible mark on societies, economies, and healthcare systems. We examined how these outbreaks not only resulted in immense loss of life but also prompted significant changes in public health policies and practices. As we reflect on these events, it becomes clear that understanding the past is crucial for preparing for future health crises. The lessons learned from these pandemics emphasize the importance of robust public health systems, timely responses, and global cooperation in combating infectious diseases. We encourage you to think critically about the role of public health in our lives and the importance of staying informed. If you found this video insightful, please consider subscribing to our channel, liking the video, and sharing it with others who may benefit from this information. Together, we can foster a greater awareness of these critical issues and promote a healthier future for all. Thank you for watching, and we look forward to bringing you more engaging content on important topics.